Welcome to Savita Dental College, Lecture Cast and Prosthodontics. Topic for discussion is Special Complete Dentures. Special Complete Dentures can be classified into complete dentures with mechanical retentive components, single complete dentures, immediate dentures, overdentures and obturators. A conventional complete denture with mechanical retentive components is used when retention is compromised due to residual ridge resorption. Springs, intermucosal magnets and suction discs can be used for extra retention. Some patients may have a completely edentulous maxillary arch, partially or a complete dentulous mandible arch, or vice versa. In those patients, single complete denture is indicated. Usually, before fabrication of single complete denture, occlusal modification of the remaining natural teeth are required. Occlusal modification of the natural teeth can be done by any of the following methods: Swenson's technique, Yurkstas technique, Boucher technique, and Boucher technique. According to Swenson's technique, a tentative teeth arrangement is done using a diagnostic cast. Occlusal discrepancies are marked and reductions are done in the patient's mouth. In Yurkstas technique, a U-shaped convex metal plate is positioned over natural teeth to record occlusal discrepancies. Occlusal discrepancies are reduced in the diagnostic cast and used as a guide to reduce the natural teeth. In Boucher technique, the occlusal discrepancies are arbitrarily reduced in the diagnostic cast and an acrylic resin template is fabricated over the reduced cast and used as a guide to reduce the natural teeth. According to Boucher technique, artificial porcelain teeth are arranged in edentulous cast articulated with tentative jaw relation. Porcelain will abrade the occlusal discrepancies in the diagnostic cast, and during insertion the abraded cast is used as a guide to reduce the occlusal discrepancies. A single complete denture can be classified into maxillary complete denture opposing a mandibular natural dentition or a mandibular partial denture, or a mandibular complete denture opposing a maxillary natural dentition or a maxillary partial denture. A maxillary complete denture opposing a mandibular partial denture is always clinically very significant due to their complications. Common complications include combination syndrome, wear of the natural teeth, and fracture of the denture. Combination syndrome was proposed by Kelly in patient wearing a maxillary complete denture opposing a mandibular distal extension prosthesis. It progresses in a sequential manner and it contains two types of sequences. Sequence 1 of the combination syndrome: excessive load on the anterior region of the complete denture leading to ridge resorption in the maxillary anterior region. A place fissuratum is formed at the maxillary labial sulcus. A downward movement of the posterior plane of the occlusion producing excessive resorption of the mandibular posterior region. And similarly, a downward tilting of the occlusal plane in the posterior region produces an anterior open bite which leads to supra-eruption of the lower anteriors, and this vicious cycle continues. Sequence 2 was proposed by Craddock. In this, there is a gradual resorption of the distal extension residual ridge in the mandible. This leads to tilting of the occlusal plane posteriorly downwards and anteriorly upwards, and rest of the vicious cycle continues as in the sequence 1. Immediate dentures are a complete or a removable partial denture constructed for insertion immediately following the removal of natural teeth. It can be classified into interim immediate denture and conventional immediate dentures. Complete denture, which receives partial support and stability from one or more modified natural teeth, are called as overdentures. They can be classified into tooth-supported overdentures and implant-supported overdentures. General considerations during diagnosis and treatment planning for an overdenture includes maintenance of periodontal health, reduction in crown root ratio, success of endodontic therapy, coverage of denture-bearing area, design of the denture, and ease of use. Abutment selection criteria includes the periodontal status of the abutment, the location of the abutment, the endodontic and prosthodontic status of the abutment. Clinical procedures include preparation of the natural teeth to receive the copings, and then the remaining procedures follows the normal fabrication of a complete denture. Implant supported overdentures. They offer many practical advantages over conventional denture, which includes decreased bone resorption and better stability. There are two types of implant supported overdenture. They are called as bar attachment and stud attachment. Thank you.